Welcome to another episode of What Brings You In Today.
I'm Erica Bennett.
And I'm Care Hope Rockwell.
And we just want to thank our listening audience for tuning in. If you haven't already, please like and subscribe so you can stay up to date on all of our new episodes.
And if there are any particular topics you're interested in or any guests you'd like us to have on, you can let us know at sgmc.org/podcast.
All right, so today we are here with Cindy Martin and Kathy Murchie from Lab Services. So, ladies, what brings you in today?
So, we are here today to talk about the laboratory services we provide. Most people in the community probably do not realize that 70% of diagnosis and treatment in this hospital are done based on laboratory services. So, we're going to talk a little bit about that today. And we're excited to be here.
All right, sounds good. We were excited to have y'all on because we agree with that. Lab is something that is performed hundreds of thousands of times throughout the year, labs on our patients, and a very important indicator to diagnosis.
We do actually 2.5 million labs
Wow.
on average per year.
That's incredible.
So, yeah.
But most people are not aware of that because they just give their blood and they don't know
They
what
don't
else
know.
happens
That's
behind
right.
the scenes. So that's what we wanted to kind of raise awareness of that today. But before we get into that, let's just, if you'll tell us a little bit about your career and kind of what interested you even in and how you got to where you are today.
So I'm Cindy Martin, and I'm the current interim director. It wasn't a role I thought I was going to have, but we've done hopefully a great job while we've been here. And then I'm here with Kathy Murchie today, who's our blood bank specialist, and I'll let her speak on her own. But I kind of ended up in laboratory services by mistake. I was a history major.
Oh.
My advisor at VSU said, over there at the technical college, they got this little program called medical technology, and maybe you might want to go over there and see them because I can't keep you out of the science lab. So I came over here and worked as a phlebotomist. So as many of us, we started a career as a phlebotomist, and that's the person that goes out and draws your blood, and that's who most people think are lab people. And so I've worn many hats through the years after 44 years, so we're excited.
I also fell into the laboratory field by accident. My mother was a blood banker here for 22 years, and I was a business major and took a biology class and got very interested in the science part of it. And I talked to my mother and other people, and they got me into the field. I worked as a generalist for many years, working in chemistry and hematology and blood bank and microbiology a little bit. And over the years, I've gained experience in blood bank, and now I'm the blood bank manager. Been blood bank manager for the last 7 years, and we're hoping to take this into the future with the trauma program that we've got going on and the new building that's coming up with the maternal services and emergency services that are going to heavily involve the blood bank and the services we provide.
And in our health system, I think you're most commonly referred to as the vampires of
Correct.
the system. And you all
In
wear
the red
red
scrubs.
We do. We
scrubs
wear
to
red
signify for the lab. So let's talk about some of those services that you mentioned. Let's talk about what labs we offer in regards to breast cancer awareness and detection.
We are very excited to bring some new cutting-edge technology to this area. We're the only people south of Macon that has brought in this technology. So about 45 days ago, we brought in testing for HER2 and ERPR testing. So this is testing to help diagnose a form of breast cancer. So as women, we like to plan. So when a person was diagnosed with breast cancer, they had to wait 7-10 days, business days, to possibly get a result to start planning their treatment. Well, that's not good for mental health. We all know that we like Dr. Google, and we can.
Yeah.
Okay?
Yes.
And Dr. Google is not your friend, but when you don't get your information quickly and timely, then that's where we turn. Okay. Mm-hmm. So by bringing in this new technology, we have turned that around to 2 to 3 business days, and that is so wonderful for these patients. Typically, it's 2 days, but if you get that 4 o'clock in the afternoon when it may be 3 days, but that is still so much better than what we were doing. Spoke to the Millers, and the Millers says that they're getting their results. Our pathologists are excited to provide that, and digital pathology is going to allow us to do some other great things like in GI and stuff like that as we move forward. So we're really excited about that.
So that means faster results for the patients.
Correct.
More quick treatment. That's
They can start
incredible.
Reduced anxiety,
They can start
yeah, you
planning
can-
that option, reduced anxiety, right? Let's trigger down. Are you going to have chemo? Are you going to be able to take a pill? Are we going to need to do radiation?
Right.
Are we going to need to do
Surgery.
surgery? Yes, I couldn't think of the word. But thank you.
Good catch,
Surgery. So we need to give those options to our patients as quickly, and we also want them to stay here local so that they can get their treatment local, and this will help keep people here and not somewhere else.
Yeah, the breast center is certainly one of our most advanced programs in that we've put together a very quick turnaround time so that if a result shows on a mammogram and they need that nurse navigator to walk women through that process very quickly and timely, and it's good to know that now we have, I think maybe a few years ago, it was a couple months from the first, like maybe scan and questionable scan to treatment plan, and then they were able to reduce that down to like 12 weeks or something. And so now with this, you're able to even take that time down
Take
even
it quicker. And y'all, and the hospital had done a great job at reducing everything, and then we were the final piece of the pie to make that so much better. And so we've been doing that since about August, and so we're real proud of that.
That's awesome. And then as far as just general primary care, what does a lab typically tell physicians? I know most people get one ordered at their annual visit. What kind of things are the most
for
common?
primary care, it's probably some of the most common things that we do that everybody would know would be like a CBC that's going to tell you if you're anemic or something like that. And then it's also going to tell you things like what is your blood sugar, what is your cholesterol. Those are your wellness type visits. As we get older, we start doing A1C so that we can monitor. So you can't cheat. So your blood sugar doesn't look good today. And then for your blood work, so the A1C is kind of like the keeper of the gate. For men, we do PSAs, which of course leads to other prostate things to be done. But those are primarily your wellness visits. We also support the Cancer Center in other ways. We are doing a large number of bone marrows, and we're very proud that we can do those bone marrows for patients to help them out. CT helps us by doing the CT guided, so we're a partnership with radiology. So lab is kind of in a silo, but we do get out there.
And you really touch a lot of patients.
We do. We do. Mm-hmm.
Every patient.
We also almost every patient. Right? We also monitor treatment. So, like you have a drug level, you want to make sure that your drug levels are good. Coag is a big thing that we do. One of the big things that has exploded for laboratory, and I didn't even include those in the 2.5 million numbers, is the point of care testing that we do in the physician practices. That's where they dipstick your urine and they can tell you immediately, are you pregnant, are you not pregnant, does it look like you have a UTI? We oversee that whole program too. And so we have about 100 instruments, I think, out there right now.
And I was going to say, like, just in the hospital here at our main lab, what kind of testing? I know there's all kinds of equipment back there. I mean, it's like a whole contraption. We have the tube system where people can send labs, and it goes from patient floors to your area. But what kind of, for people, because most people don't get to see that. So just give us an insight. Tell us a little bit about what's operating back there.
Oh, it's fun. So the first thing that happens is we have to identify our patients appropriately. So we go to the bedside, and that's our phlebotomist. That's the vampire. Gets out there, and they identify their patients. And then we have a little mobile device that we use to do that. And then we print the labels at the bedside. And when we print those labels, they have a barcode. Then we run over to the pneumatic tube, and we drop it in the pneumatic tube. The longest it takes from anything to go from any pneumatic tube to us is less than 2 minutes, which is pretty awesome. You can't walk that fast. No. And that is over from the ASC building, not the ASC, the professional building.
Wow.
So that's really exciting. And then it comes into an area called specimen processing. And once it hits specimen processing, they receive the labs. And once those labs are received, a lot of things go on in the background. It puts it on a line, and it travels around, so that little instrument goes around. It takes caps off of the tubes so that we can test them. It says, okay, what instrument can I use? This one is stat, so how quick can I get it turned around? Let me send it over here. I need to bump somebody out so that I can get this ER specimen done quicker. I'll bring the routines back in. And is it calibrated? Is it controlled? Are we putting out a good result? And then it goes to a storage facility. And then Dr. Kathy calls up and she says, I need to add a test on. And we say, okay, and we do a couple of clicks on the computer, and the robot goes and gets it and brings it back and runs it.
Wow.
So we don't have to do as much hands-on as we used to, but we still need those educated people to make critical decisions when things don't look right, so that we can question to make sure we're getting out the results. So.
And speaking, you were interested in biology, you were in the lab. What kind of person would a career in lab, what kind of student or interest would someone have that you say, hey, you need to think about lab services?
Oh,
Kathy?
If you're trying to talk to the youth right now that may be interested in this in the future, but because it's not a well-known career choice.
That's true, but that's where a lot of shadowing comes in. High schools and middle schools and colleges can bring students through the laboratory for tours, and we also accept student shadows and any, I guess, job fairs or whatever. I mean, I guess there'd be student fairs or career fairs, things like that would help get the word out, because I mean, even I had a laboratorian in my own household and I was unaware of what the laboratory was. My mother kept it very under wraps,
Right.
while I was coming up through school, so I didn't know basically what she was doing until I was an adult. So, and started asking questions. So it's important for us because we are so introverted and drawn in that we keep to ourselves and we're hidden away and we're not really out there for people to see what we do on a daily basis. So, a lot of people don't know who we are and what we do.
Do you do a lot of research?
Research, not so much in the hospital environment, but there are R&D. And I mean, if you get out into like industry, and they do a lot more research and development.
There's probably a lot of opportunity for that. I'm just thinking as we continue to grow our
Right.
medical education program and our partnership with Murchie, that might
we
be.
do some research. So I also oversee the reference lab department. So out of the reference lab department, we do send a lot of research specimens off to different people.
I believe our cancer center
The
does a lot of
Cancer
research
Center, they
too.
have a whole research team, and we aid in getting those specimens ready and stuff for them to go. But we don't pick who we're researching.
Right, yeah. Makes sense.
Interesting. So, can you talk about how these lab results that you're getting through this really cool automated process, how are they influencing the decisions that then the providers are making? So, they're getting our lab results back, and then what happens?
I feel like they're very influential because if we don't have them ready in time, we are getting phone calls asking about where these results are. So I believe they are very influential in the decision-making process. Of course, there's the clinical side of it, not just the biological or biochemical side of it. So they come together to help the clinician make the decisions for the patient. But our contribution is very important to their decision-making
So
process.
another one of our big service lines is cardiology, and we have expanded it tremendously. So the laboratory helps them determine through troponins, is one of the big ones today, is are they having an active heart attack? Are they not having an active heart attack? Do we need to take them to the cath lab right this minute? Now, we're not the only thing that makes that
Right.
decision,
Sure.
but we do play a big role in it. And sometimes they do it, anybody that's having chest pains as a screen, and it's a surprise to the doctor when they get it. And those results can cause them to change the treatment of the patient immediately.
Yeah.
It's important for it to
so-
come out as quickly as possible and to be accurate at the same time. I mean, we want fast, accurate resulting.
Like what
so
you
they can make
said,
their
the
decision
labs
quickly.
don't lie if they're done accurately,
That's
right?
correct.
But a lot of the external factors, the observations that a physician's doing of a person or their symptoms can vary so dramatically. But the labs, they're kind of like that telltale of what
It helps to verify what
indicators.
they're thinking if they're going down a particular path or
There's some treatments
Disprove it.
like diabetes or glucoses that somebody that's got a real low blood sugar may have some of the same symptoms as someone that has a real high blood sugar.
Yeah.
And so you need to make sure that
You
you're
need that
treating that patient
verification.
appropriately so that you can treat them right. Because we don't want to give them glucose if their glucose is high. So,
And then on another aspect of blood is the blood donation and what that means in blood transfusions and stuff. So maybe talk a little bit, about the importance of blood donation and what it means.
Well, first of
for
all,
a
with
hospital.
no blood, we don't have a product to give to the patient, so the donation is critical. They're all voluntary. We don't. No one is, I believe, paid, but they are compensated in some ways. Like they might get free T-shirts or gift cards, things like that. Nice little gifts they sometimes get from the blood collection facilities to help with that. But blood donation is crucial for us being able to proceed with what we do. I mean, our people donate whole blood, and from that we get packed red cells, we'll get plasma, platelets, and cryoprecipitate, among other things, to give people as a component therapy. We gave out about 7,000 products last year, and we're holding steady at about that same rate this year. So, I mean, that's a lot of blood to come through the blood bank. And
Who's the biggest, where is the biggest utilization of blood? Is it trauma? Is it cancer? What
I would
area?
think cancer and inpatient would
Okay.
probably be more than
'Cause it's a
emergency.
steady.
Yeah, it's like it's a steadier flow coming through cancer and inpatient, rehab, places like that. But, or maybe not rehab so much, but, a little bit of emergency in there. I don't really keep hard data figures on that, but yeah, I just feel like inpatient and cancer center do utilize a lot.
And we have a partnership with LifeSouth. So LifeSouth Community Blood Centers is the sole provider of the blood donations
Yes.
to SGMC Health, all of our facilities. So can you talk about that a little bit and what that partnership means for us?
It's very important. And we've been in partnership with LifeSouth since 2016. So it's been 9 years now, and they have been critical in getting our blood here quickly. Also, they have a great reference laboratory that we utilize quite a lot. They have great medical technologists working there and get our blood and blood tests turned around very quickly. So that's very important too. I mean, we have doctors waiting to give patients blood, and sometimes they have multiple antibodies and difficult situation going on, and they need that blood product as quickly as possible, and LifeSouth really does a great job of getting that turned around as quick as they can.
One of the great things with LifeSouth is if I were to walk in and give blood at LifeSouth, that blood most likely 99% of the time is going to come back to this facility.
Right.
The only time it might not is if there is a special need somewhere else and I have the special blood that they need, then it may travel somewhere else. But that's a great partnership that we get all of our blood back.
I would like to shout them out for their response. And a few years ago, we had a traumatic situation involving Valdosta High School, when thank goodness it wasn't it was a hoax. But as soon as I called them, they had 160 products on a helicopter getting ready to put it in the air
Wow.
to bring to Valdosta. So they have been very responsive. So when we have issues, they're right there, and they've been very good. We've been very satisfied with them.
So if you haven't donated blood before, or you are an active donor, if you donate at LifeSouth, that's just an important way that as a community member you can give back, and I think it saves 2 to 3 lives per donation is what they say. And so we partner with them. We host blood drives here at the hospital, but of course they have a location that's right across from our hospital on Woodrow Wilson Drive that anybody can go donate at any time. So we highly recommend and encourage that because that's critical for our patients and their success. And it does stay right here. So it's a good way to get back to the patients here locally in our community.
And there is a critical need for blood donations right now across the country, but even here in South Georgia. So it is very important.
And only a small percentage of people actually donate blood. So it is important to just raise awareness of that. And if you are able to just take that hour or less that it takes to stop by and do that, certainly you're impacting lives greater than you know. And it's a good
And
way
a lot of the businesses in town will allow their staff to stay on the clock while they go by and give blood.
Yeah.
So,
And they allow the buses to park
Yeah.
in their lots, and we appreciate that.
Right.
Yeah.
Yep. So if you're a community organization that are looking for a good way to give back, you could, I'm sure LifeSouth would be happy to partner with you and bring their bus by your facility. So good plug for blood drives. What would be a little known fact that people don't know about labs, or something that the lab services?
The little known fact.
Or something people.
I would say just about everything's a little known fact with the
All of them
laboratory.
are.
But it's just that most of us are. Sometimes we're called introverts, but sometimes we can be very fun to be around, and some people just don't know that about
I
laboratories.
think one of the things that they don't realize is that lab staff has to get the same type of education nursing does.
That's
Yeah.
another thing. that is
We
known.
go through, our 4-year program is actually a 5-year program because we do about 18 months of clinicals. So we train at the arm of somebody. In the state of Georgia now, a biology major or a chemistry major could qualify to work in the laboratory, but then we have to give them that clinical training before we can release them to do their own work. And I think people don't realize that we have the education because they'll say, oh, you're just a lab person. And that's not really true. Even our phlebotomist that goes out and draws patients, they have to go through like a 6-month training program, and they've probably stuck dummy people or people that know that they're in training 50, 60 times before they ever go out and start drawing patients. So I think people forget that we're educated, and I think that
Well, and
that's an
biology
awareness.
in particular, that's like the hardest subject there is, I feel like.
Y'all are
in
young,
school.
so y'all don't know fatal fetal. So
A lot of our,
And we talked a little bit about phlebotomists too, but what are some other roles that are within laboratory that people would not know because they are more behind the scenes?
well, I mean, they range, all across the spectrum, as far as education and experience. So we have a pathology team, we have secretaries and phlebotomists, of course, and then we have our med lab technologists and med lab technicians, and have various education levels. But we have, and of course, our histology team and cytology team.
Tell me the difference between histology, pathology. Tell me a little bit, just for because I don't
know all the
remember that from
difference.
school. So give us a little high level.
I'll let her answer that.
So the histology pathology department is if you go into surgery and they take something out of your body,
Okay.
it is going to arrive in the laboratory for us to process to do something with it.
Okay.
It's hopefully we're saying that everything is normal. Okay. Like you had your gallbladder out, there's no cancerous there. It was just that it was a bad gallbladder. So we call it the parts department, and they're kind of stuck back in the back. It's kind of gross and it's kind of scary, but
That's why they call it grossing. When they're
they
working
call it
with
grossing. Those people actually have quite a high level of education. We have pathologists, and the pathologist is who actually does the diagnosis for cancer treatments. So, and they spend a lot of time with that.
Yeah. And I've seen those departments, and I've been here 13 years myself, and I still didn't really understand all of that stuff. So that's very enlightening. You really have the whole spectrum.
We
of
typically
care.
do not take any young people that are touring through that department.
Yes, that's right. Because you have a lot
you
of.
see things that you don't.
That they may not expect.
Well, and there's a lot of people can't handle the sight of blood in general.
We'll take college.
so-
We'll take college level.
Yeah.
Shadow people through there, but we typically do not shadow young people in that department.
Do we have volunteers that participate with lab services
Oh,
from
yes,
the
we
high school
do.
students?
Yes, we do, and we love them.
Yeah. I'm
So-
sure that's a really interesting one, very interactive that they get to see.
Oh,
the
yeah.
Get
behind
to
the
see
scenes.
things. Yeah, we have double-headed microscopes, so they can sit at the microscope. They can't, of course, they can't treat anybody.
Right.
But they get to see what a blood cell looks like. They get to see what micro looks like. I have strep throat, so this is what strep throat looks like and how we diagnose this. So they get to see, simple things like that.
They like to
Yeah.
see the blood typing and
Yeah.
other
absolutely.
testing where you actually use a test tube and you could see the colors and the agglutination and things
Take
like
and
that.
swab your hands.
Makes
to
it look
see
like
what
real
grows.
science.
Oh.
Oh, yeah, the little hand situation.
No, we'll
with the-
swab them and let them see what bacteria grows on their hands. Yeah.
That's a good way to remind people to
Nice.
wash their hands.
To wash their hands, yes.
Goodness. Okay, I don't want to think about all the germs, but they're there. We learned a lot about that during COVID, right? And we
Yes,
learned
we
to wash our hands.
did.
And then y'all played a huge role in that as far as diagnosing and getting treatment options.
The
for that.
laboratory actually became to the forefront during COVID. We had been kind of in the background, but all of a sudden we're in the front of everything. We
Yeah.
were the superheroes.
Yeah.
Us managers.
Yeah, we were,
that
as
did-
introverts,
yeah.
we were a little,
We hadn't worked,
Little
on the
blushing
bench
over
for a
that.
while. Yeah. And so all of a sudden we're out swabbing noses
Yes.
and we're running tests.
Yeah.
We, at the height, actually did like 3,500 in one day, and we probably could have done more, but
Yeah.
we were a community saver around
Right.
here.
That's right.
Absolutely.
So I can still see those cars
I know.
wrapped
I
around the
know,
building
yeah.
And I pray we never have to do
and
that
blocking
again,
off
but-
smoking pig.
Yes, all the drive-throughs. That was wild times.
That was wild times, and hopefully we're never there again. But we learned
Yeah.
what we're made
That's
of,
right.
and we stepped forward. And
Well, and I think it keeps
we did a
like you
great
on
job.
the innovative end too. Is like, what else can we do? Speaking of that HER2 testing, what else can lab offer that can help the different areas in the hospital? I know you mentioned, we're building our new Women in Infants Tower and our new emergency, which will feature neonatal care and trauma and lab certainly plays a role in both of those.
And that's the
Blood
blood bank
bank's
was
gonna
probably
be-
going to get a lot more work, you know, and more specialized work when that opens up. Neonatology, they utilize a lot of blood products that are specialized blood products.
Because of the distance, one of the things that they've done is they've already been working on putting some blood products in the ER, so that it's very easy for them to grab and go. And so we've been experiencing that, and Kathy's worked with Emily's team on that. And now that we're going to be farther, we may have to expand that service. So
It's a possibility.
you know, we're there to support the service lines, and you know, we never know what they'll be.
Yeah.
we're
But
glad
when
to
every
step
second
up.
counts in the ER, you have to be
That's
able to
right.
grab what you need.
That's
and,
right.
You know, help to save someone's life. So
And with that'll come, you know, higher trauma, and that's better for the whole community. So
Quick response.
you want to be able to stay with your loved ones, and not everybody can travel. So.
Absolutely. Absolutely. Well, we thank you for
We
joining us
thank
today.
y'all.
Is there anything? Well, we do have one final question.
one
that we
final
ask
question, our very fun one: what is your favorite meal to eat here in the cafeteria or the Allspice?
I like the brisket. That's or the spare ribs.
Yeah,
I am a hot banana pudding kind of girl.
I love that.
It reminds me of my mother and my grandmother.
Yeah.
So
Those are good choices.
Good answers.
All right. Well, you heard it here, folks. The lab team, and you'll never see them because they're always behind the scenes, but just know that they're there and they're working diligently for you. And then, again, if you can go donate blood, please do so. That's a great way to give back to our community and our patients. So with
we
that,
appreciate y'all.
Thank you.
thank y'all for everything you do.